This short video is on the rehabilitation of golfer's elbow. We will aim to keep this video as short as possible, but without compromising on vital information. If you are watching this for the second time, then we suggest you skip the short theory section and go straight to the rehabilitation exercises. The exercises are grouped into the stretching or mobilizing type and strengthening type. It's also known as medial epicondylitis. Medial means the inside aspect. So if I'm holding the arm like this is the medial aspect because it follows the little finger, and that's the lateral, the outside aspect. So that protrusion we see there on the bone is because we have quite a few muscles attached to it. And these are the muscles that perform mostly flexion of the wrist and flexion of the fingers, yeah? So these are the flexors. And medial epicondylitis appears on the medial aspect of the elbow or golfer's elbow. So let's begin with some stretching exercises. First of all, put your hands on your wrist, extend your elbow fully. That's it, get a straight line, and then gradually pull your wrist backwards within your comfort zone. If your wrist has a problem, if it's painful, don't push it any further. And also if your fingers are painful, hold the palm instead. And just extend your elbow, hold it for say count to 3, relax, and then repeat it again. That's very simple stretches of the flexor muscles. Next exercise, we're going to stretch also the extensors, which are mostly situated at the back of the arm. And for that, we need to do this kind of maneuver, yeah? So we are flexing the wrist. Depends how flexible your wrists are. You may achieve a bit of stretching, you may not. If you have very flexible wrists, you might be taking the joint to the end of range and then have pain in the wrist. Don't push it beyond that, yeah? So where do you feel the muscle stretching?
All
on the outside, yeah, good. If you have edema or swelling or puffiness or fluid retention in the muscles, doing this with the arm elevated takes down the pressure and takes down the fluid into the system. Yeah, so it's doing some flexion and extension with the arms elevated. Palm facing up, that is supination. Do some pronation and then supination all the way. Take it to the end of range until you feel the muscles twisting, and then again the other way. Yeah. If we have the arm straight, we don't achieve that because the whole thing twists from the shoulder. But by bending it, we are confining the movement to the forearm. Okay, now, Andrea, we're going to do some eccentric exercises whereby you will assist your own hand to bring the weight up, and then in a slow, controlled fashion, allow the muscles to elongate by extending your wrist as low as it would go. Good, and then assist it again. And lower it again in a controlled fashion, take it to the end of range, and then repeat again. Let's continue the exercises now using a loaded arm to do some twisting of the forearm, that is pronation and supination. In a controlled fashion, drop the weight down all the way, and then supinate it or twist it the other way as far as possible. So that in a way we are toning up the muscles, but also we are stretching them as well. So we're achieving two things at the same time. Another modification to that is for you to hold a hammer and do that. Try and use the hammer to do the same maneuver. Again, this is a lighter instrument. It's not as heavy. But by using the hammer, you actually gauge the amount of rotation you're achieving. Maybe in the beginning, you couldn't do that much. And as you are progressing in your rehab program, you can do more rotation. Yeah? Andrea, the next one is strengthening the grip of the hand by squeezing a ball. This one it's a soft ball with plastic spikes, so it also massages your hand. But you can also use a smooth ball, provided there is some elasticity to it. You try this one and do some wrist squeezes. Yeah, hold on to it and then relax slowly. Good. And again, squeeze. Pause to 3 maybe, slightly softer this one, and relax. And again, squeeze. And relax. Thank you. Whilst you're doing this, you can study your geography as well. Andrea, the next exercise, again, is using some weights to do eccentric exercises. If you haven't got a hammer, if you haven't got a weight, you can take a shopping bag, put some weights inside. Let's start with something manageable. In this case, I'm putting 3 grapefruits. Okay, so so you want to do this maneuver for me, holding the weight.
Sure.
Wrap it around your wrist, so you're not gripping a lot with your muscles. I want your hand to be more relaxed. So wrap it around there. And then, as we said, assist it upwards with your other hand.
Okay.
Yeah. And then lower it down as far as it will go. And again, assist it all the way to the top and gradually descend the hand like that. We are now going to do a bit of elbow flexion with a very small, modest weight because we're dealing with the flexor muscles primarily, so we want to tone them up a little bit. It is a very small weight, but we don't want to put a big weight at this stage. So do you want to slowly control flexion?
All the way up?
Yeah. If this condition is active and inflamed, when you do flexion of the weight, it will be painful. So you may want to keep the angle a bit opened up. We don't want to squeeze it and then cause more irritation. Up to a comfortable point. Let it extend all the way down, though. Fantastic. Thank you. We can do something similar now with the elastic band.
Okay.
So we don't want a very tough elastic band, something that is easily managed. And you can step on one end. Depending on the length of the band, you may want to wrap it around your foot to make it shorter, maybe. Good. So again, keep your elbow by your side so you are supporting your arm. And do the whole motion again. Slow motion descend. And again, do it a bit slower when you go up. So we want to have a slow, progressive tension. Excellent. Thank you. The next one, we are using the band again, but we're going to actually exercise. One of the activities that this muscle does is basically the supination or twisting and upward movements. So under resistance, we're going to put the band on, maybe on a handle, on the door or somewhere like this. So Andrea, what you're going to do is perform this kind of twisting like using a screwdriver, which in fact, this is what it does. Keep your elbow by your side, 90 degrees. That's it. Rotate upwards and then down. And then again. Make sure it is within your manageable kind of range. If it's too tight, too difficult, get closer to the attachment. If not, go further away to make it harder. Good. Thank you. This next exercise, Andrea, it's meant to stretch some of the muscles behind your arm here, some of the muscles that control the shoulder joint, so that we have better use of the whole arm. It's no point just focusing on one single area, which is basically where golfer's elbow is, into the middle side. We want to address the adjacent area so that we're functioning well. So for that, I want you to put both elbows or one elbow onto a soft surface. And as you drop your body forward, you should be able to feel the stretch. Okay, most people won't be able to go that far. So let's do it within, say, a modest range to show what you'll be able to achieve. Yeah. So where do you feel the stretch now?
Underneath my arm.
Under the arms, yeah. And the scapulae, under the shoulder blades. Yeah. So that we're stretching the extensors, things like the triceps and part of the latissimus, if we want to get technical with the muscles and so forth. And slow motion collapse. Obviously, be very careful and not to sprain your back muscles. If you have a vulnerability there, maybe you want to get your knees closer to the stool so that you don't go down that low. Yeah. The next exercise involves you lying down, and you're going to use that small weight to perform some exercises of the arm. Yeah. Good. And then the other way. Good. Don't forget to breathe. A lot of people hold their breath while they're exercising because they're tensing, but you need good oxygenation for the muscles. So make sure you remind yourself, deep breath. Great, thank you. Face down on a soft mat with your arms wide open and your thumbs pointing up towards the ceiling. And in a slow and controlled fashion, you raise them, you squeeze your shoulder blades, and then slowly go back down as well. You're engaging several muscles there just to tone up the arms and the scapulae. Good. The final exercise is what I could call it chest rotations. Basically, it involves you rotating one hand all the way back with your chest, of course, and with your palm in this direction so that we are stretching all the front muscles of the arm and the forearm and even the pectoralis and so forth. Yeah. So, yeah. Point your fingers back as well. Good. Bring it forward. Where do you feel the stretch?
In the shoulder, in the armpit, all the way down
And
to the arm.
even point your fingers backwards as well, so that we're stretching all that front muscle, yeah, which are the flexors, yeah. As you take it to the end of range, point your fingers back. Don't forget to take a deep breath at the end so that we're stretching those muscles even more. Hold the breath and then go back forward. That's a good exercise. Great, thank you. Golfer's elbow or medial epicondylitis, additional management advice. Avoid painful movements, particularly those that involve straining the forearm muscles. Reduce repetitive twisting movements of the wrist, gripping and lifting. Make sure you take regular short breaks from activities that aggravate your elbow pain, such as typing, lifting, or repetitive work. If it is to reduce pain, for example, the use of ergonomic equipment, and limit the stress on the tendon by adopting a relaxed grip. The application of ice packs to reduce inflammation, compression, self-massage, medical acupuncture or dry needling, strengthening exercises, the use of straps, braces and splint devices, exercise modification, topical anti-inflammatories, advice on load management, and in stubborn cases, consider the use of steroid injection. Eccentric exercises definition. These are active movements that lengthen the muscles, which are unlike the passive stretching exercises. It's a type of strength training that targets specific muscles to control a weight as it moves in a downward or away motion. An eccentric contraction is the motion of an active muscle while it is lengthening under load.